Well, suicide prevention and suicide in general is just a topic a lot of people are not comfortable with, and I have to admit, I was one of those people.
I feel really strongly that suicide prevention is everybody's responsibility. And it's a reason, there's a big movement towards, I think in the VA, educating everybody about suicidality. And even a lot of the trainings that they provide on TMS are focused around developing some degree of minimum competency, and I think that's important and necessary. Just think about how you might be the person that somebody discloses that to for whatever reason. Even a technician answering a phone call at a call center, you might be the person that somebody makes a vague statement to, and you should know what to do, have a general sense of at least what to do in those moments.
When I had my first experience with a suicidal patient, I was all set to do diabetes. And he kept mentioning about a fall that he had and how bad his pain was. He couldn't handle it anymore. The things he was saying to me were not things he normally said about his pain. If I don't make it, I don't care if I don't wake up tomorrow. This pain is taking too much of my life. That scared me.
I had one particular veteran who was given some news that they were facing criminal charges, and after hearing that, they got all their affairs in order and began to take some preparatory actions, including returning their vehicle, organizing paperwork, organizing all their medications, and they were given that information at 10 a.m. and waited until our appointment at 4:30 in the afternoon to basically, it wasn't clear when we began, but then through the course of the appointment, it was clear that they had suicidal intent. And in that moment, I kept the veteran talking in the VVC appointment. They had a loaded firearm with them in the appointment. And then I contacted the police and used teams to activate a number of people to start help me diffuse the situation. This particular veteran was in their early 30s and was very fearful about spending the rest of their life in jail or prison based upon some criminal charges. But they waited 6.5 hours after they were told that information until our appointment. And I mentioned to the veteran, I said, it's remarkable that you waited all this time after returning your vehicle, getting all your affairs in order, putting all your medications in specific places, and you waited. And I have to believe that a part of you wanted me to stop you. A part of you knew that I would stop you and would intervene on your behalf. I'd like to hear more about that part of you. The veteran was stopped and the police came. The police would not go inside the veteran's apartment. They would not do it because there was a loaded firearm, so the veteran had to leave their home. And the police made sure that they parked their cars like a good block and a half away, so there were not just this string of all these emergency vehicles outside the veteran's door. They waited down the steps with the crisis counselor there, and they introduced themselves to this veteran, and the veteran already knew who these people were because we talked about them. And the veteran told me it was a very comfortable experience and it felt safe. The process of intervening has to feel safe too, because that can feel really scary to be converged upon by a multitude of different healthcare providers and police could be a very frightening thing. So a lot of it was just talking the veteran through the process of who's coming, who they are, where you're going to go, what is the experience of where you're going to go going to be like. But that moment of saying to the veteran that you waited 6.5 hours, and I believe that a part of you wanted me to stop you. A part of you wanted me to intervene. I'd like to hear more about that part of you. The veteran was in tears when I said that, and then started talking about the reasons they had for living. And we were able to even then kind of talk about a safety plan and go into some safety planning in that moment, organically. It was a VVC appointment, in their home, and the veteran was in their pajamas in bed, which was unusual to me. And the veteran looked as though they had been crying. I could see that. Those were the only things that were unusual when the appointment started off. And then the veteran proceeded to tell me, as I asked how their day was going, that they were served that morning by the chief of police in the area they lived in about facing charges that would result in them going to jail or prison. And people who face jail or prison, puts people in a high-risk category for suicidal thoughts and behaviors. And that's when I thought something is certainly off here and I need to dive into this deeper. And then I actually told the veteran, when people face charges such as those that you were presented with this morning, there's risk around having more suicidal thoughts. And I said that just as a statement, and then the veteran started to cry, and then said that they were planning on suiciding that afternoon, were not planning on telling me, and things kind of progressed from there. I was still on the VVC appointment with the veteran when they left the home. That I wanted to stay engaged. I wanted to continue to look at each other the whole way through. I never wanted to break eye contact, essentially, as best I could. And so the veteran carried the phone with them outside as they left their apartment to meet the police. I actually heard them exchange hellos by the time the call was disconnected.
I wish I could say I have no personal experience with suicide, but I've lost a lot of friends and people in my community to suicide, and I wasn't able to be there for them. But there was a turning point in my career and in my personal life with one of my patients that I saw. He's a Vietnam veteran, came in for a diabetes management appointment. I'd seen him for a couple of years, so this was nothing out of the ordinary. He came in that day, and I could just tell something was off. He was really quiet. He was tearful, hopeless, just really withdrawn. And I noticed his diabetes control had begun to decline over time. And I could tell there was something deeper going on with him. And I really needed to figure out what that was, because I didn't think addressing just medications at that moment would really make a difference. I had never asked any of my patients before if they had thoughts of suicide or thoughts of harming themselves. It took a little courage for me to ask that for the first time. And to be honest, when I asked him that, I really just expected a no answer. So when he answered yes to those questions, that he was suicidal and he had different things that he had been thinking about of potential ways that he could end his life, I was shocked. I was unprepared. And here I am in the position to be face to face with someone and potentially save a life, and I didn't know what to do. And one of the things I learned about during this encounter was a safety plan. I had never seen a safety plan. I had never heard of a safety plan. But throughout this visit, we were able to sit down and actually fill out a safety plan. And if you don't know what that is, it's just a plan that you can actually go over with a patient who may be in crisis, where you identify protective factors for living, support people to call if they are in a crisis and need help, ways to take their mind off of the circumstance that's put them in the crisis. And this veteran trusted me. We were very close. I saw him every month for several months, and I felt like I needed to be the person to sit down and go through these things with him. Throughout completing the safety plan, I felt at the end of the visit that we had mitigated that risk. He was no longer an immediate threat to himself. We deemed he was safe to go home. And I like to think we saved his life that day.
When I had my first experience with a suicidal patient, I was all set to do diabetes. And he kept mentioning about a fall that he had and how bad his pain was. He couldn't handle it anymore. the things he was saying to me were not things he normally said about his pain. If I don't make it, I don't care if I don't wake up tomorrow. This pain is taking too much of my life. That scared me. Because I knew something was different in his demeanor. I knew this was not my normal patient, the way that he acted. I said, I hear what you're saying, and I want to help. He didn't want to be a bother. And so I reassured how much I care for him. I was able to do a warm handoff to the Suicide Veteran Crisis Hotline. We both conferenced in. I made sure they knew who the patient was, what their name was, where they were, any other information about what was going on. The lady on the other line said, I have it from here. You're okay to hang up. And I made sure that their provider knew, the mental health provider knew, everyone knew what had just happened, so that the whole team, we together, were helping this veteran. And then also alerted his providers so that he got the care that he needed. And I saw him again for diabetes, and he was so appreciative of the help. And he was doing it in a much better place. And honestly, it hasn't come up again.
Did you think that little intervention would have that kind of effect?
I was hoping he would get the care he needed. But to create that relationship with that patient that he felt comfortable enough to tell me what was going on, I think meant a lot to me. You don't think a diabetes call is going to go that way. And when it does, it can be life-changing.
I once thought, as a pharmacist, I wasn't properly trained to assess for suicide or suicidality. And it's become more aware in my career and in my personal life that it's everyone's role. Everyone should know how to ask those questions and be prepared to be there and to help that patient. Pharmacists have a lot of touches with veterans, and we could very well be the last person they speak to. And we need to be prepared to be there in the event that happens. And it will. At some point in your career, it will happen.
First and foremost, suicide prevention and suicide risk reduction is everybody's responsibility. It's everyone's responsibility, and sometimes what it really takes is to listen and to show somebody that you care, and you'll continue to be there to see them through the moment that they're in, the crisis that they're in. If you notice something, ask about it. If you notice something, talk about it. Don't leave something unsaid. If a friend makes a vague statement about having suicidal thoughts, ask him about it. Ask your friend about what's going on. What did you mean when you said that to me? To never shy away from even the most vague statement about safety. That's the starting point. The veteran told me that staying calm and presenting lots of education and explaining things was extremely useful. I think that that's very important too, because there's a lot of doubt and uncertainty what's going to happen. Part of it is just a fear of the unknown and what's going to happen. What's going to happen in my life? What's going to happen with me going to jail? How am I going to feel this way forever? These are all the different thoughts that go through people's mind when they're thinking about ending their life, at least some of them. So when you're able to explain more about where they might go from here, what their life could look like, what treatment might look like and how it could change, what are the services and resources that are available, what you've seen at work for other people, and how their life might be different 5 years from now, I think that affords people hope in a moment where hope is the furthest thing from them. And I always say to them, your future self will thank you for making the choice to be here today. Because you can't imagine what your life will look like 5 years from now. But I imagine you'll have learned from this, you'll have grown from this experience, After it was all done and the veteran was safe, I knew that they were in the hospital. The police had called me and debriefed with me. I talked to the chief of psychiatry. I sat in my office and just had a few tears to myself. Just from the intensity of it all, and also just to think that I was grateful for how things turned out, and then I felt prepared. That veteran came back after being in the hospital for 7 days, and with tears in their eyes, thanked me and said that you saved my life, the VA saved my life, and I'm really glad, I'm very hopeful. I didn't know that I was gonna get a lawyer, that I was gonna change my medications, that now I'm working with a therapist. This is the first time I've really ever been this engaged in treatment, and I've probably needed it for a very long time. And I'm very grateful to the VA. It was pretty amazing.